Hi, I'm Dr. Enriquez, founder of CSF, or Surgery for Patients Without Insurance. The reason why I started CSF is historically I used to treat patients that would go across the border. But not necessarily border from Mexico. They could go to El Salvador, or they would go to Nicaragua. They would come back with problems, with complications. They did their surgery far away, and either they didn't have their doctor to help them out, and they wanted to see a doctor here in town. And by tradition, when you have surgery far away, few surgeons want to take care of you because they don't want to take care of complications that were done in another country. So CSF, and the term CSF means Surgery Without Borders, and the name comes from that. I wanted to eliminate or erase the border so we can do those patients here, and they did not have to travel far away. In a specific case that CSF was involved in was this 40-something-year-old male who had an enormous tumor in his neck, and he had seen multiple doctors in the community, and he was rejected all the time. This tumor continued to grow to the point where he actually had to buy a recliner, put a hole in the recliner so he can put his tumor, fit the tumor in the hole so he could sleep because he couldn't put his head flat. So finally, when he came to CSF, we evaluated the case, and I considered the patient to be a good surgical candidate. Surgery was done successfully. This patient couldn't work. He had to sustain a family of 3 or 4. They were in great trouble. He was so desperate that he wanted to attempt to cut this thing by himself. But eventually, once the surgery was done, this patient returned to the community. He's actually producing for his family, for the community, and this is the cases in which CSF wants to help always win with those patients.